Suddenly you come upon an accident on the side of the road where a man is lying lifeless. Would you know how to give him CPR in order to save his life?
Coming up next on the Men's Medical Moment.
Each year in America, over 7 million people suffer injuries in which they desperately need CPR to survive. These victims cannot wait the time it takes for medical attention to arrive to achieve the oxygen their brains need to survive. Without CPR, permanent brain damage begins after the start of oxygen in 4 minutes, and death can occur as soon as 6 minutes beyond that point. For this reason, we give you 7 simple steps to give another person a fighting chance to live. Step 1. Access the unresponsive person by asking them if they are okay or alright. Now, it is okay to give CPR to a person who is not breathing, but not to someone who is simply unconscious. So you have to know the difference. Now, you also want to check the situation, make sure there's no dangers to you giving CPR or the person in that area. Step 2. Call 911 immediately or ask someone who is with you to do the same. The 911 Emergency Center has computerized instructions for giving CPR should you lose your cool in this process. Step 3. Place the person on their back to see if they are breathing by watching their chest rise and fall, as well as listening to the air escaping their mouth and nose. Now you want to put them on a level, flat surface, not a mattress, not a couch. You need to compress the chest, not furniture. Step 4. Clear any obstruction from their mouth and open their airway by tilting the head back slightly while uplifting the chin. So when you uplift the chin in this particular situation, it opens the airway. Step 4, and this is critical. If none of these signs is present, place the palm of your hand centered on their breastbone, and that's in the chest. The breastbone is a thin, flat bone running down the center of the chest, connecting the ribs just beneath the nipples. Now, then interlock your hand. So you're going to put the top hand over the bottom and begin chest compressions, about 30 chest compressions at least 2 inches deep, while keeping your arms straight and your body erect over the victim. So you're going to do a 30 to 2, 30 chest compressions, 2 quick breaths. Now we move to step 5. You pinch the victim's nose shut and place your mouth over the mouth to make a complete seal. Now you want to blow into the person's mouth to make the chest rise with 2 quick breaths, or you may use what's called an ambu bag. An ambu bag is a manual resuscitator or self-inflation bag meant to provide positive pressure ventilation to patients who are not breathing or not breathing adequately. So you could either do it with your mouth, you do it with an ambu bag, or you can do it with a protective cover over the mouth. Step 6. Continue with the cycles of chest compression and breathing until an ambulance or automated external defibrillator, or what's called an AED, arrives. Now today, AEDs are self-actuating with audible instructions in order to shock the victim's heart back to beating. You may have seen the larger version in movies where the doctors put 2 paddles on a person's chest and says clear, and then they shock them back to life. Now remember, 30 compressions per 2 breaths for upwards of 120 compressions per minute. Note, end the cycles if the scene becomes unsafe or you're unable to continue performing CPR due to sheer exhaustion. And this happens in these cases. Now, in the case of a smaller child, so we're going from an adult to a smaller child. So in the case of a smaller child or baby, some steps are slightly different. So be very careful not to cause more harm than is already present in this situation. So these are very careful instructions. Now you can go take these classes at your local Red Cross for free if you want to help people out. So in the case of a smaller child, number 1, after attempting to get the child to respond by calling out their name in a loud voice, hey, and tapping on their back or the bottom of their feet, then you may begin CPR. We want to make sure that they're unresponsive. 2, place the child on their back on a firm, flat surface. So you want to compress the child, not furniture. 3, kneel beside the child, check for breathing. See if the chest is rising and falling and the air escaping from the mouth and nose. And then make sure there's no obstruction to the airway before beginning CPR. So if they swallow food or something that's preventing them from breathing. 4, Give 30 compressions by placing the heel of one hand in the center of the child's chest, not the two hands. Now position your shoulders directly over your hand and lock your elbows and keep your arm straight at all times. Number 5. Push down hard and fast about 2 inches at a rate of 100 to 120 beats per minute. Now allow the chest to return to a normal position after each compression. So as you go down, allow the chest to come back up each time. 6. Open the airway to a slightly past neutral position. Use the head tilt back chin lift technique. So you want to lift up on the chin and the head will rise and the airway will open. Number 7. Pinch the child's nose closed and blow into the child's mouth for about 1 second twice. So 2 breaths for every 30 chest compressions. Ensure each breath makes the chest rise. Allow the air to exit before giving the next breath. If the first breath does not cause the chest to rise, retilt the head and ensure a proper seal before giving the second breath. So again, you want to make sure that the airway is not obstructed. If the second breath does not make the chest rise, and an object may be blocking the airway, and you want to clear that before you go on. You don't want to push any object deeper down the child's throat. 8. Continue giving sets of 30 chest compressions and 2 breaths until you notice an obvious sign of life. After that, you can taper off. Now, an AED is ready to use. Another trained responder is available to take over compression. EMS personnel arrive and begin their care, or you are alone and too tired to continue. Also, you have performed approximately 2 minutes of CPR or 5 sets of 30 to 2. So it's a 30 to 2 ratio. 30 chest compressions to 2 quick breaths. The one-hand method is for children 1 to 8 years of age. Beyond that time, it is a two-handed method. So 1 hand for 1 to 8, 2 hands, which I showed you before, and lock your hands from 8 to adult. So we've come finally in the case of a baby. And we're going to take special care while knowing at the same time that our inactions will not help this child's survival chances. So, to begin, you place the baby on its back on a firm, flat surface. In each situation, it's a firm, flat surface. Because we want to compress the child's heart on the outside of the ribs, but not on a couch or a chair. Now 2, kneel to the side of the baby with your hips at a slight angle. 3, check for breathing. So look at the chest at an angle and you check for breathing and rising and falling and air escaping from the mouth and the nose. Then you want to check for any obstruction in the throat before beginning CPR. We don't want to push anything further down the child's trachea. 4, scream the child's name out and tap at the feet or stimulate consciousness anywhere on the legs. Make sure the child is not just in a deep sleep.
You're watching M&N, the Men's Channel.
Number 3, for a baby, place 2 fingers on the center of the baby's chest. You can't use chest compression with the hand or 2 hands, just below the nipple line. 4, push hard down and fast about 1.5 inches at a rate of 100 to 120 beats per minute. Now allow the chest to return to its normal position after each compression. This is critical. 5, for a baby, if you can't reach a depth of 1.5 inches, consider using the one-hand technique, but very liberal in your pressure downward. 6, this procedure can also be performed by cradling the child with one arm on your knee. Right? So you got the child and bracing the head, one hand on the knee, and the other 2 fingers to perform this maneuver. Now, 7, open the airway to a neutral position using the head tilt chin lift technique. You form a complete seal around the child's mouth and nose. So for a baby, it's different. Okay? For 1 to 8, you can pinch the nose. For the baby, around the mouth and nose. So you want to blow into the child's mouth and provide it air, 2 quick breaths for 1 second. Ensure each breath makes the chest rise. Now allow the air to exit before giving the next breath. If the first breath does not cause the chest to rise, retilt the head and ensure a proper seal before giving the second breath. If the second breath does not make the chest rise, an object may be blocking the airway. And as I said before, when giving anybody CPR, you do not want to push anything further down the trachea blocking the air going and coming from the lungs. Now continue giving sets of 30 chest compressions and 2 breaths until you notice an obvious sign of life. Child starts crying and starts breathing on its own. An AED is ready to use. Another trained responder is available to take over the chest and compressions. The EMS personnel arrive and begin their care. Or you are alone and too tired to continue. Now the scene becomes unsafe when you're performing this exercise. Another reason to stop, or approximately 2 minutes of CPR, 5 sets of 30 to 2. You are alone and caring for a baby, and you need to put the child down long enough to call 911. So we thank you for watching the Men's Medical Moment, and we hope to see you again next time.